Hey there, welcome back to another episode of the Battle Buddy Podcast. You wanna catch this one. This is a great nonprofit we're gonna highlight today. And as you know, if you've been following me for a while, I absolutely love talking to people with nonprofits, especially those really deep into the veteran space. We've got America's Warrior Partnership on today, so stay tuned and let's learn a little bit about what they've got going on.
Welcome to the Battle Buddy Podcast with Keith McKeever.
So today I'm joined by Kaitlin Cashwell, Director of Community Integration, correct?
Yes, that's
All
correct.
right, awesome. So tell us a little bit about yourself and how you got involved with America's Warrior Partnership.
Yeah, first of all, Keith, thank you so much for having me, and thank you for recognizing that nonprofits need all the help they can get when it comes to highlighting the great work that they do. So I have been with the organization since inception, holding various roles. I actually started as the CEO's executive assistant, and so it is helpful to kind of know all the ins and outs of the organization and the community integration program, which is the foundational model. And it's kind of what I do every day now with branches. And so we have community branches across the country directly supporting veterans, and then corporate initiatives, practically engaging veterans in the workplace. And then we have training initiatives. We actually have a training later today to help communities just grow what they already are doing to better support veterans upstream, to improve their quality of life and to prevent veteran suicide.
Awesome. Since you've been there since the beginning, I'm sure you've seen all kinds of crazy ideas come and go, and definitely being there from the beginning, you've seen every aspect, I'm sure. Uh, what, in a nutshell, is America's Warrior Partnership? You kind of hinted at a few different things there. Could you take that a little extra level deeper there for us?
Yeah, of course. So our mission is to partner with communities to prevent veteran suicide. And we recognized most recently through an evaluation grant that our model, focusing proactive and holistic, leads to improved hope, improved quality of life, and suicide prevention. So, with America's Warrior Partnerships mission, we kind of take that community integration model throughout all of our initiatives. Currently, we have the national network, which is working with communities to connect veterans down to their community, and then connect communities to additional resources when the resource does not exist or has been exhausted. So if you're in a community in rural areas or tribal areas, not all of the things exist that are in like a big city like Atlanta, Georgia. So really helping the VSOs, which kind of hold the ground in some of those rural communities, helping them get connected to additional support. And then we currently have community integration, which I just talked about. And then we have Operation Deep Dive, which is a suicide prevention research study. It is really understanding at the community level how a veteran before they died by suicide was interacting within the community. That's one aspect. And then another aspect is looking at data from the matching medical examiner's information to the DoD and confirming their status as a veteran. This actually looks into non-natural causes of death as well. So not just suicide, so overdose,
Which is a
vehicle.
tough thing to figure out because overdose could be suicide, could be
Exactly.
intentional or unintentional, which, you probably agree with me, the 22 a day number is a very underreported number. That's
Mhm.
just what the VA knows. It doesn't take into account things like that, the unintentional suicides and things like that.
Right, and they don't research that, and so it's just different what we research from Operation Deep Dive, and we also don't consider their discharge status. So it's anybody that ever served. So that's what they're looking at on the Operation Deep Dive team. And I'm not an SME in Operation Deep Dive, but I actually reap the benefits of the findings of Operation Deep Dive because they help us understand what maybe we could implement within communities and to train other communities on how to just work more upstream and to consider those things. Substance abuse is something that is trending recently. We've been doing trainings on that, to just get communities to start thinking about, what resources they would tap into, to support some of that going on.
Absolutely. You hit on a couple of points. Before I ask another question on Operation Deep Dive, you mentioned rural communities and tribal lands and all kinds of other places in between that have a lack of resources. I just had a friend of mine share on Facebook one of Mike Rowe's Facebook shows that he was running. I don't know if he's still doing it, but it was from a couple of years ago. And the lady was like hour and a half south of Detroit or something like that, and she was in a small community, like 20,000 people in the community, and there was nothing. A lot of guys were, a lot of veterans were like, you know, I got to go across town for food pantry, or I got to go get, go all the way to Detroit for this or that. It's not an uncommon thing around this country. So it's great to have those resources in those smaller communities and figure out work for those people who just don't have, may not have a vehicle or can't find a way to travel 3 hours.
Exactly. Yeah. Yeah. So the network is there in the places that we can't be. We can't be in every community. But navigation, you're right, is a lot of the hard part. And the community integration model really helps to understand the veterans in the community and know where those gaps are and where the barriers to access are. For example, one of our affiliates in Buffalo, they helped advocate for the bus route to be changed because the veterans in a particular community couldn't get to the VA. And just they had to take, like, I think an extra 2.5 hours to get their route right to get to the VA, and then let alone just have a VA appointment, which takes a long time. So they were able to work with leadership in the community to kind of say, this is a barrier. How can we get a direct route for these veterans to meet that need? But yeah, the navigation process, the understanding what even is out there is a lot of what we've kind of worked to tackle with communities.
I think that's what I liked about learning a little bit about your organization when we talked before and looking at the website and everything since is there's something like 50,000 veteran nonprofits out there. And what most of what you're doing is gathering data, interpreting it, and figuring out how to connect people to the resources. All these other nonprofits or government agencies and all these things that are out there, because the help is out there. It's just finding it. I've been doing this show for 2 years, and I've only, interviewed, a couple of dozen nonprofits out of 50,000. There's a lot of other people that are doing amazing stuff out there that just nobody knows about. So
Right.
it's great to have, kind of bridge that gap, be that bridge to somebody to get the access they need. Because I can't imagine not being able to drive a car and having to figure out, okay, I'm here. How do I? How many buses do I have to get on to get to my VA clinic in order to get on their shuttle bus to go 3 hours or 4 or 5 hours to the main hospital, and then spend a day there, or to like I know people like that have to jump through some hoops like that or catch rides with people. That uses up so much time, flexibility. I mean, so there's a lot of access issues for people. I think that's one of the big ones. So, but the Operation Deep Dive, I know you're not the subject matter expert in it, but is there anything that you're aware of that's kind of come out of that that's kind of interesting or shocking or eye opening about what they're finding on those in those cases?
So, National Guard is one of them. That's something that we all kind of knew that we were seeing. The biggest finding that we've kind of seen out of Operation Deep Dive is everybody kind of measures things differently. So like you were talking about with measurement, I'm glad you get it. I was like smiling a little bit because it's hard to kind of see, the why and the purpose of that data and being proactive. But we found that there was a program in one of the states that only asked if the person that was deceased served in the Army. That's it. They didn't
Oh,
ask if they served in the military. They didn't ask if they served in the Navy. They just wanted to know if they served in the Army. And so you can't really investigate that data because you don't have the whole picture. And so that's kind of one of the things that Operation Deep Dive has been advocating for, is just kind of, getting the whole picture, bringing everyone together. They're partnering with the DoD a lot of other people are working with the team to just come together and piece the puzzle together so that we can have that viewpoint to look upstream.
There's nothing like data. Yeah, maybe I'm just kind of a nerd, but you can't make educated decisions and take action on something if you don't have the clear data. But of course, you got to just work through it. It just takes time and processes and changing policies or whoever that was tracking just Army. That's kind of ridiculous. Yes, they may make up a good portion of veterans,
Yeah.
but you're forgetting about all the other branches, and I don't know, maybe that was just somebody who just gets stuck in that mindset. Some civilians who don't have any interaction with the military veteran community will just kind of lump everybody into Army, which is frustrating. Any veteran listening to this or watching this knows exactly how I feel. It's frustrating. You earn that title of Marine or Airman or Sailor. You brush it off most of the time, but when you hear something like that, it's like, what about those Marines? What about those sailors, the Coast Guardsmen, the Airmen? We earned those titles.
Yeah.
And it would be a simple fix from Army to Armed Forces. And then you should hopefully catch everybody. But anyway, that's it.
And that's some of the beauty of that model that I talked about. We do a 4-step plan of connect, educate, advocate, and collaborate, and the education to the community of things like that, because not everybody served in the military, and the amount of people that are military connected is declining every day. I mean, we did a poll through our mission roll call program, just identifying that the younger generations do not know somebody that served in the military. And so just the education is going to become more and more relevant to understand and bridge that gap.
Well, I saw somewhere, trying to get the numbers as close as I can, there's something like 19 million veterans out there. But, I mean, we had 16 million that served during World War II. Well, now we're down to 150,000. There's a website out there you can track that. We're losing 200 plus World War II veterans a day. In a few years, we won't have any of them left. So the total numbers at 19 million or so veterans is something like 5%, give or take, of our population. But I know in my generation, everybody kind of refers to it like, oh, we're less than the 1%. Because you're right, like, there's less and less people. We didn't need 16, thank goodness we didn't need 16 million people to fight the war on terror. That would have been a whole different ballgame. But, yeah, there's a lot of misinformation out there. So I love that you guys are doing that to kind of correct some people along the way.
Yeah. And then too, to feel like you're a part of it. I mean, every holiday I have an excuse to like put out flags, if it's Armed Forces Day, Labor Day, just to kind of be that example. I mean, it takes each and every one of us to hold on to that. And both my grandfathers served in the military. I have 2 brother-in-laws that served. And so I want my kids to understand how much of an honor that is, and how it is a piece of our country, and we should respect it.
That's awesome. Well, every parent should do that. They should take the time to teach their children about military service and the sacrifices and what's needed. I'm lucky enough that I took my oldest to, he got to fill an extra seat on an honor flight and went with me. And,
awesome.
So every time I step into Arlington National Cemetery, I mean, it looks pretty much the same every time, but it's a different feeling every time. And it's just, there's nothing like going in there. If anybody's been in there, they know the feeling. But halfway through that trip at the Vietnam Wall, he put his arm around me and said, "I know why you guys volunteer." Like something connected in him of like, I get why people serve. I get, he kind of picked up even at a young age, like this connection of, why you serve, how important it is, why veterans are so connected to each other. So, but of course, when there's a lack of connection, that leads to lots of problems. So, like lack of connection to community. I know that's a big one, is community integration that you deal with. But can you break that down more for us, what you're doing in your department for the integration stuff?
Yeah, of course. You're making me a little teary-eyed though with the Arlington, because one of our board members, Leo K. Thorses, he was a Medal of Honor recipient and a POW for 6 years. He was buried there, and I was very fortunate to be a part of that. But yes, I get the same awe going there. But and I'm glad your son got to experience that. So connectedness, yes. Community integration really emphasizes the connectedness piece. We know that strong relationships, spirituality and purpose, connected to yourself, is a piece of our holistic model. I've been studying hope for I think it's been 9 years. We've been doing our annual survey and understanding, what affects hope in a positive way and what affects it in a negative way. Because I am more of a hope expert than a suicide expert, but we are studying the living through that survey and understanding both that there's a will and a way when it comes to hope. So the model with these advocates that we have locally and through our national network, their role is to, find that pathway to what they're trying to access. And we know that certain times, for the majority of the time, veterans are seeking for more resources. So like you said, having that kind of easy button to help you navigate where you need to go is part of it. And it's a walking with you, not for you. So we really emphasize solution focused, and let's teach the veteran how to fish. And a lot of times then they'll be able to help navigate others as well. The veteran population is very much about helping their brothers and sisters in arms. So creating that way for them at an individual level, and we do it on a community level. So like I talked about with Veterans One Stop and the bus route, like say, a majority of the population is living in this community and they can't get to the VA. That's where the veterans are. This should be an easy thing for us to think about changing. And then the will. So that's the second part of the hope, will and a way. So, it might be that a veteran doesn't want to ask for help. A veteran doesn't know that they're struggling with something. A veteran doesn't know what even is available to them, whether it's the GI Bill or VA healthcare. With the PACT Act coming out, we learned that extends to more people for VA healthcare. And there's a lot of misconceptions of VA healthcare. And I've heard multiple times that, I don't want to take advantage of my benefits because that would take it away from somebody else. And that's just a misconception. So just kind of really being that listening ear to understand them, and then to say, these are all the cool things that you could take advantage of in the community, is a part of that model. There's so many facets to it, but kind of the quick and easy way to say is community integration is a veteran-focused, community-led initiative to proactively engage veterans in the community and ensure access to resources in collaboration with existing programs. So we are not direct service providers. We work with what is existing, and we help just kind of bridge that all together and bring the veteran to it, and it improves their quality of life, we've seen. And that's our upstream approach to ensure that veterans don't fall through the cracks, don't lose that hope. If you're turned down from a VA appointment, if you're told your claim isn't going to get accepted, like, how does that make you feel? It's not a good feeling. So any veteran that we can meet and to kind of work through that with them is a win for us.
Well, once again, like I kind of alluded to earlier, I love that you guys are like the connector of the roadmap. As you're talking there for a minute, I'm like, there's so many resources and so much information. It kind of makes me like think of a kid trying to clean their room and they don't know where to start. Or like, you put somebody on the edge of the forest and say, okay, all these trees are veteran resources. Each one of them does a little something different. I want you to find one, you're looking for one tree in this forest. Go find it.
Yep.
But you don't really know what tree it is or what it looks like or how big it is or where it's at in the forest. You have no trails to go off of. Where do you start? It's too much to navigate. So That's one thing I love about it. Kind of provide that path and the waypoints and some signs here to say over there, it's over there.
Well, and it's kind of like in the military as well. I was trying to help my sister-in-law with navigating some things with her move, and some stuff got jumbled around. I mean, it's not beside the military community to kind of just say, well, it depends if it's Tuesday or Thursday. So just kind of being that welcome wagon to be like, well, I know exactly where you need to go on Tuesday versus Thursday, and you need to talk to this general or this lieutenant. It's not unique to kind of what is known in the military. It's not easy. It's not easy to navigate these things. Even as a civilian, I have a hard time navigating healthcare. If you were going to see a specialist, you don't even know what's wrong with you, and then they're like, well, you can't really go to this person until you go back to your primary care physician, and it's just the reality of community systems.
Well, then you complicate things with people who have physical injuries, or somebody who has an invisible wound, PTSD or traumatic brain injury. And confusion might come about even faster, quicker, and then you're looking at it like, I don't know where to go. The path may be clear. They may be being told exactly what you need to do to get what, but that it's just an extra layer of complication on top of things. And let's just face it, the VA system is just complicated. It's government. It's not going to change. You just got to figure out how to navigate and find the right connection pieces. But I love that you talk about hope, because I don't think I've ever really heard anybody mention hope when we talk about suicide. Um, and I've got your website scrolling across the bottom. I'll put it in the show notes too, American Warrior Partnership. But I just want to throw another one up here, since we're kind of diving into a deeper topic. If somebody's struggling, remember the suicide prevention lifeline is 988 press 1. Just want to have that scrolling there in case anybody's watching or listening. But everywhere we talk about suicide, but we don't talk about the hope and why people live, why people make that decision to take that gun out of their mouth, drop the needle, stop doing whatever negative, bad behavior they're doing to themselves. So I'm curious, have you guys found any common trends or things that are giving people hope, that are pushing people past that point?
Yeah. So with the holistic wheel, I always look about, if you're connected to a job that you kind of consider a career versus just or like a hourly job. We've seen that hope is improved through the connecting to these holistic things. Healthcare, transportation is a really big one. If somebody doesn't have the ability to navigate throughout the community, I mean, you can't connect to friends across town. You can't go to VA healthcare appointments. You just are kind of stuck if you don't have transportation. So that's one thing that is a huge proponent of ours. We have a information system that like flags certain circumstances as red. So like pay a special attention to this, work closely with it. Don't let it be a kind of push off. Transportation is one of them. We same with like healthcare. So if they're not enrolled in healthcare, that's just a huge barrier. Healthcare costs are just continuously increasing.
I'm going to focus on that for a second.
Yeah.
And I'm going to ask for a percentage. I know you probably don't have that exactly off the top of your head, but roughly what percentage of veterans do you think are struggling with healthcare issues and are not in the VA system for whatever reason?
I gotta go back and remember. Sorry, I don't have this one. But
a rough number, I'm just kind of curious.
Well, not everybody's eligible for VA healthcare. So, and then we get sometimes issues with like dental. That's something that is so hard for us to find through the network resources related to that. But we have, I think, about 40% of the people that we serve are connected to VA healthcare. So that would be of the ones that we serve. But now it's been extended, so there's work to be done to educate people on that and to get them the paperwork and all of that.
Well, I think most veterans understand that, there's guidelines or requirements, to be in VA care, but I think it'd probably be shocking to most civilians to hear that not every veteran is eligible to go to the VA for health care,
Mm-hmm.
which
Oh, yeah.
personally to me is mind
I
blowing.
mean, I'll raise my hand. Before I started working in this industry.
Everybody who serves should be able to go get health care. Very basics. Dental is another one. I'm still dumbfounded why dental isn't included. It's so important. I'm no dental expert, but I know that your dental health is important to your gut health and all kinds of other things. I don't know. It would be like a proactive way to stave off other issues, I would think. Just me. I'm no doctor.
Oh, yeah.
But,
It's a preventative, yes.
And preventative measures save money down the line. Just like homelessness. If you can keep people in homes and get them jobs and earning money, then they're not on the streets causing, strains on nonprofits or strains on the government or whatever.
Mental health.
It's all about mental health. Yeah, I mean, give people access to stuff, and you can stave off some of those other bigger expenses down the road.
Mm-hmm.
But anyway, that's just me. Maybe we'll have some senator or representative listen to this and be like, "Oh, that's a good idea. We can run with this." Maybe we'll get
lucky. Yeah, and I mean that's the biggest part too, is just them knowing about it before it becomes an issue. So take advantage of your VA healthcare, even if you don't need it right now. Just get enrolled. You can still go see your favorite doctor, but if you ever do need it, is kind of where we stand on that. And same with like enrolling in e-benefits, because that's the gateway to all things that you need in the VA. So like, let's get your VA card, let's get the documentation, make sure you have your login so that you can be empowered if you or your family member ever needs to access it. And there's a lot of work that we do with family members and caregivers, so we never exclude them. We see them as like warriors all together. But a lot of the times you're working with family members and caregivers to just kind of talk about maybe any changes with veterans, or just kind of nudge them and say, hey, like they'll reach out to us and say, hey, we need so-and-so to enroll with VA healthcare. And so we'll help walk them through the process so they can kind of be the advocate, almost like train the trainer, just to make sure that the veteran, I mean, not every veteran wants to ask for help. I don't like to ask for help myself. So we try to be very available and accessible, depending what each veteran needs, in like a one-size-fits-one approach, is what we say.
Yeah, it's kind of odd that we have this mental block when it comes to asking for help. A lot of it comes from our time in service. You got to be proud, strong. You got to, be this rock, this foundation. Can't show this weakness, right? You have to have this warrior mindset, mentality, whatever. But yet, at the same time, we all thrive in the military. We're a team. We're only as good as the weakest link. So you rely on your buddies to your left and to your right. It's what you do. That's how the teams efficiently run. So it is kind of mind-boggling that how you rely on everybody next to you left and right for all of these things to be effective in service. You don't rely on the resources that are there when you're out.
Mm-hmm.
And I'm guilty of it. I never saw any counselor for 13 years after my first deployment. It was 9 years after getting out of the military before I saw a counselor, and it took a battle buddy of mine to kind of slap me through the telephone and tell me I was stupid for not seeking a counselor and talking through issues and dealing with things. I don't care what you're dealing with. I think every veteran should go to VA mental health. Everybody should have a counselor and see them at least a couple of times a year. Talk through things in life.
Mm-hmm.
If you're out for 10 years, other things in life are going to happen and pop up and cause stress to you too. So talk about them. It doesn't have to be all about your military service.
Yeah. And peer support. Peer support
is
another thing that we push very much. That's for Warriors is the one national resource that's really good. But But no, you're right. And I love the chain analogy, because we had that in our original playbook. Is veterans are all this long chain in a community. And if one's weak or broken, then the whole chain is gone. So it's like why we support all veterans is because then, yes, the veterans can help the other veterans and just make that one individual. So kudos to your buddy for helping kind of lift you up with him, to recognize the need.
Yeah, well, I'm not surprised you did it because I don't know if he'll ever listen to this. He'll know exactly who it was, but it's not the first time in life that he's helped me course correct and probably saved my life in one way or another. So and that's what it's all about. You got to have those conversations and those connections. It wouldn't have happened if I didn't have connections with him through Facebook, and we don't talk very frequently, but we do talk every now and then, and so it's important. So I mean, that's one of the things I love about what you're doing, because you've hit on a couple of different things. What I've noticed starting this, what led to starting this podcast, what I've noticed since then just reinforces it, is that there's really like 5 pillars to things that cause veterans to go into homelessness, substance abuse, and ultimately suicide. And to me, one of them is financial and legal issues. One of them is close personal family relationships. One of them is physical and mental health. The other one is lack of connection to the community. And I don't think it has to be necessarily the veteran community. Just a connection to the community in some way, shape, or form. Doing something to volunteer, being able to get out and about and, go down to your favorite diner and have breakfast and know that the waitress in there you see every day, or, the bank teller that you run into every week, whatever. Just being in your community. And then the last one is like purposeful employment, and so the community and the employment are the things you hit on. I think is so huge. Somebody with a job or a purpose, something that they're happy that they wake up in the morning and you're excited to go to work. Because if you're not excited to go to work, you probably shouldn't be working in that job.
Yeah.
Don't put that extra stress on you. You don't need it. My old man told me that once. He worked in a coal mine for 25 years, hated every minute of it. And I think he was stressed when the coal mine shut down. But he had told me many times, he goes, don't ever do a job that you hate. If you get up in the morning and you hate it and you're pissed off walking out that door, don't do it.
Mm-hmm.
So I think there's something really big to those two things that you mentioned, and I'm really glad that that's kind of a focus of what you guys are doing in the community care, because I think they're 2 of the big 5 pillars, and I think the more of those that are lacking for somebody, the more likely they're going to end up in one of those 3 situations, and then you got a real hard time digging out.
Yeah.
So,
it's got to be the whole person.
Well, just as with any change, right? You have to be able to see it in yourself, see where you're at, and reflect, and be like, I don't want to be here. I want to fix this. Mm-hmm. And until somebody's at that point, they're not going to fix themselves. Family can try all they want, friends can try all they want, but until that person's made up their mind and they've decided, it's not going to happen.
Mm-hmm. There's something so important too about just being known, like you were saying, in your community, like somebody knowing if you don't show up, like somebody knowing if you don't pull your trash back. I have a neighbor that's one of those neighbors. Right. He's actually a military Vietnam veteran, command sergeant major, and he's like, just one of those neighbors, like, why didn't you pull your trash back? You know what? Thank you for just recognizing that I'm here. And it's important. I've been in the same community all my life. I think you mentioned you have too, but it's just having somebody know your name when you go out, just having a purpose, whether it's just a smile in the community, I think is so relevant.
Yeah, to not just be invisible or be stuck in your house and whatnot. So, so is there any other? Flip that back here, so it's scrolling again for your website. But is there any other resources or other things that you guys have got going on, or projects, or I think I have here in my notes, Mission Roll Call, some other things?
Yeah, Mission Roll Call is a program of America's Warrior Partnership. They are making the veterans' voices heard. So there is over 1.5 million people that they're communicating with and accepting polls from. So just really kind of understanding where priorities lie. I know one of them was suicide prevention, so that came from the veterans, and then family members and caregivers to say that that was a priority, and we just take it to community leaders and national leaders and say, this is what your people are saying. It's almost like a virtual town hall, to just share that data and say, what do you want to do with it? And then telling stories of veterans, VSOs, community leaders, just hearing from them about where they're making their priorities, and just kind of letting people know about what they're working on.
Awesome. Another great data point, right?
Exactly. Yeah.
Awesome.
Yes, we do love data.
Yeah, can't go wrong with it. So, awesome. Anything else that you guys have going on that we haven't talked about yet?
I mean, so you said you were a nerd. I'm doing a lot of evaluation. We do emphasize that as well, just continuously refining our projects. And I was able to do some things with the CDC, to just refine the community integration approach. And so I'm looking at the Navajo Nation right now and seeing how our model is improving collaboration and connectedness. Um, so we always kind of emphasize a one size fits one veteran approach, and then also one size fits one community approach. So that's allowing us to kind of work with the community, the Navajo Nation leaders, the veterans there, to work with with what's existing. And then we're going to take that evaluation project to our other branches across the state of Alaska. Is one of our branches. Indianapolis, Indiana is another branch, the Panhandle of Florida, and the Permian Basin in Texas. So taking that same, model and evaluation plan to understand how we are improving those communities as well. So we have a lot of diverse communities. We have tribal, through Alaska and the Navajo Nation, and then we have big city, or somewhat big city, in Indianapolis, and then some rural and medium size with the Panhandle and the Permian, Texas. But overall, all the communities are very positive towards the military community. So that is always making the job a little bit easier, not having to start from ground zero on that. So, and then we did an evaluation on big cities. We're doing assessments on some big cities and just how they're ranking in their support for, the veteran population. We have like a tool that we created and we've been using for the past 9 years. So just one thing that we're finding is that big cities have lots of resources, but it's not the best collaboration because you don't have to collaborate if you have a lot of resources. And then small cities love collaboration because there's no resources. They're always working together to try to make things work.
They're kind of born out of necessity. I mean, if you're going to make it work, then yeah, that makes sense. Makes a lot of sense.
So the big cities have the competition because they're competing for funds.
So then, hypothetically, medium-sized cities, a couple 100,000 people, would probably have a decent amount of collaboration and a decent amount of resources, and probably be a fairly decent place for a veteran to think about relocating.
Yeah, I mean, and the big cities are still good. It's just different. But yeah, I mean, our model was, our original affiliates were, in kind of that medium size. So Greenville, South Carolina, I don't know how I'm familiar with them, but they're doing great things. Upstate Warrior Solution, but they have that, yeah, the city where there's resources, and then the rural areas where outreach is so important. So yes, the community integration model was originally intended for those medium-sized communities because of that. But then we love a challenge. So then we take on some rural communities to figure out how we can, do better there. And then we have the model in Atlanta, Georgia, which is a big city. So just navigating that, knowing that collaboration is something that you have to work a little bit harder to because of the competition. It's not something that they're not tackling, but it is just something to be aware of.
Yeah, I asked because I kind of live in one of those metropolitan areas. It's kind of a couple 100,000 people, and I know some of the really small communities. You're going to probably have to drive to another community for something. But I think about locally here, like I'm in the Peoria, Illinois area. Got a VA clinic 25, 30 minutes from my house. The hospital is a couple hours away, but it is what it is. But we've got a great nonprofit that I've highlighted on here, Freedom Paws Service Dogs. The Honor Flight Network that I'm involved with. There's um, Fuller Life Foundation for Mental Health Resources that I've highlighted. A couple of other nonprofits in town that do fixing up veterans' houses and helping get rid of ordinance issues and stuff like that in the city. So like there's a lot of cool things, a lot of great resources, and people doing amazing things in my little community. That's like not really small and rural, but it's not Indianapolis either. It's not Chicago where the population's 5 times, 6 times as many, whatever. So it's kind of neat to be able to see that there's enough support here to keep those organizations going and doing good things, and they've got enough of a name that I think most veterans in the area kind of know who they are, or that there's an organization out there that does it.
Yeah.
So there's a little bit of a signpost there that says some help over here, right?
Yeah, I mean, and I'm sure all those nonprofits either are run by a veteran or there's veterans on the board. So it's just cool to see all the veterans that want to do better to help their brothers and sisters in arms, and medium-sized communities have enough funds to kind of raise money for those programs. So that's cool to see what's going on in Peoria.
Well, I haven't said this in a long time, but I've said it a few times before, and I know you didn't serve, but it's my thoughts anyway that civilians want to help veterans, may not necessarily always know how is best. I mean, you've been doing this for years, so you got family members that are veterans. Some people don't know anybody who's a veteran. Don't know anything about us. But we as veterans should do a much better job of having each other's backs. We have to. We have to rely on each other. We relied on each other when we were in uniform, and all of a sudden it just disappears when we're out. Like, we have to do a better job. Nobody cares about us more than we do.
Yeah. That's a good call to action, because our survey shows that, there's I think it was 40% this year of veterans that aren't doing things in their community. I mean, maybe they're misinterpreting community, or not misinterpreting, but interpreting a different way than we would. And maybe they do things with their family, but they said they don't do anything in their community. And so it's like, why? Why are you not? Why are you not involved?
It doesn't take much. You can volunteer, and other than the cost of the gas or maybe the bus ticket to get to the volunteer location, you can volunteer for virtually nothing. It just costs you time.
Mm-hmm. There's virtual options too.
Yeah, absolutely. I'm involved in the Honor Flight Network, and we have old ladies that sit around and crochet little flags.
Mm-hmm.
There's a million different ways you can support your community in one way or another.
Yep, there's Operation Gratitude, writing letters, ETS sponsorship, being a sponsor for a veteran moving into your community. It's a great way to connect, is just reach out to a nonprofit and just say, what can I do? It doesn't even have to be veteran focused. Just what can I do?
Oh, yeah, believe me, they'll take it. Got to volunteer, we'll find something for you. I was told a long time ago, you come up with any kind of idea when you got a nonprofit. What's it going to cost, and who's going to run it? That's the two keys.
Yeah.
If you got somebody that can spearhead it and lead it, and you got the funds or the ability to get the resources to do it, then you got an idea. You got a plan. So, but anyway, I really appreciate your time to come on here and talk with me and share with the military and veteran community and all my listeners about everything that you guys got going on. I really hope anybody listening or watching, if there's something, maybe even think deep, if there's something in your head, a resource that you've thought about or wanted to connect with, or just don't know where to go, well, now you got the starting point of the map right here. So just go to americaswarriorpartnership.org and start your journey. Of course, you'll be able to reach Kaitlin on my website too. I'll have your picture up there and your LinkedIn profile so people can reach out to you and connect with you. So I highly encourage anybody watching or listening, if there's a resource you're looking for, go out there and try and find it.
Yes, thank you, Keith. And can you do the crisis line again one more time? Just because
absolutely.
So if you are in crisis, please reach out to the crisis line. We work upstream to help connect you before you're in that situation, but the National Suicide Prevention Lifeline is the best spot for that.
Absolutely. If you're even having an inkling of a thought, call the number, get the help. Um, I used to save this for when I play my ending video here in a second, but I mean, I really mean it. We want you here tomorrow. Like, that's as blunt as it can be. Please be here tomorrow. You do have friends and family and people that care about you. You've got to be here tomorrow.
Yep, your community needs you, your family needs you, your battle buddies need you.
Absolutely. So, anyway, Kaitlin, once again, I appreciate you coming on and being on the show.
All right, thank you, Keith. Thank you for having me.
Yeah, no problem. All right, there you go, folks. Once again, if you're struggling, like I just said, please call the number. We want you here tomorrow. And my website is battlebuddypodcast.net. As a reminder, like I say after every episode, if there's not a resource on there that you think should be, please reach out and let me know. I would love to be able to add it on there in some way, shape, or form. Everything on this podcast and the website is about helping connect other veterans, much like our guest today and America's Warrior Partnership.